Hello and welcome to the Society with Fatma Shaheen at PTB World. Today on our show we'll be talking about the looming threat of monkeypox as it does stand in the Pakistani society today. And not only this, we'll be talking about the disease itself, its signs, its symptoms, the prescribed treatment methods, and of course the fact that how prepared are we as a Pakistani society to deal with the same. In this regard, we'll also be talking about not one, rather quite a few other healthcare challenges that Pakistan society is faced with, be it those related to the growing incidence of waterborne diseases, that too especially in this rainy and monsoon season, be it issues then which relate to, of course, women's health, more particularly to women's reproductive health, the stigma which unfortunately still surround the same. How can we do away with it? In this regard, we'll also be shedding light upon, of course, children's health, be it issues relating to their malnutrition or, of course, issues relating to their health, which then, of course, are aggravated because of increasing air pollution in the society today. In this regard, we'll also be talking about, the various initiatives that the Pakistani government is taking so as to overall, ensure better access of healthcare provision to the average Pakistani person out there. And last but not the least, we'll also be talking about, of course, the importance of ensuring that, all myths surrounding various diseases, surrounding various issues, they are done away with, because when it comes to having clear and, of course, transparent communication, we need to have two-way, of course, information and communication on one end, one which ensures that the right and the authentic information is conveyed to the Pakistani masses, and on the other hand, their community concerns, they are also at the same time looked into and, of course, are dealt with in a very prompt and efficient manner. All of this today, that too with an extremely pertinent panel. Let me introduce you to my today's panel. My first panelist for today's show is Ms. Saman Rai. She's a women health advocate, alongside being the DG of Population Welfare Department. Assalamu alaikum, madam, and welcome to the show. Thank you for joining us, madam. Alongside her, we have Dr. Naeem Majid, who is a public health expert, and he's also been the former technical focal person for immunization in Punjab. Assalamu alaikum, sir, and welcome to the show. Thank you for joining us, sir. And via telephone line, we'll be joined by Dr. Rana Jawad Asghar Saab, who is the CEO of Global Health Strategists and Implementers, GHSI, and he's also an expert on infectious diseases. Assalamu alaikum, sir, and welcome to the show. Now, before we start the discussion on today's topic, let's have a look at this brief report.
Pakistan is proactively addressing the looming threat of monkeypox, ensuring our healthcare systems are prepared and informed. Recognizing the signs and symptoms such as fever, rash, and swollen lymph nodes can help us stay vigilant and seek timely care. As monsoon season brings challenges like dengue and typhoid, our communities are stepping up. By maintaining clean surroundings, using mosquito repellents, and ensuring safe drinking water, we can collectively curb these outbreaks. Equally important is the focus on women's reproductive health and child health. It's time to break the stigma surrounding these issues so women can access the care they deserve without fear or shame. The media plays a crucial role here too, by spreading accurate information and dispelling myths about diseases like monkeypox. We empower people to make informed decisions. Together, we can build a healthier, more resilient society.
Welcome back from the break. Now, to get the conversation started with you, Dr. Saab, when we do talk about monkeypox at a very basic level, how would you compare and contrast it with COVID-19 in terms of not only its transmission, in terms of not only, of course, the level of fatality that it can, of course, have, but also the impact that it can have generally on public health, so to speak, in the Pakistani society. So, in this regard, what would your comments be, and how worried at a very basic level, in your opinion, should any person be when it comes to, of course, this looming threat of monkeypox that we are faced with currently?
If we compare COVID-19 with monkeypox virus, there are some major differences. Until very recently, monkeypox was difficult to transmit from one person to another. You need long exposures and very close exposure to the patient to get infected. While COVID-19 was spreading through droplet infection and also through air to a much wider area, And so even a quick pass from a highly infected space will make you sick. Second thing is that the fatality rate until very recently, and I'm emphasizing on very recently, was much less as compared to COVID-19. So these are like two major differences when we are thinking about, does the disease has the potential to become a major pandemic? One, what is its case fatality rate, and second, how easily it could be transmitted to other, from one person to another. And in both these areas, monkeypox was much lesser threat as compared to COVID-19. The other major differences is that we already have two effective vaccines against monkeypox, but when COVID-19 came, we didn't have any vaccine available, so we have to work really hard. Another thing is that our doctors or medical sciences know how to manage patients of monkeypox. While for the COVID-19, we didn't have that prior information, and our doctors and healthcare staffs have to learn how to effectively save people.
Right, sir. On which, Dr. Naeem, I'll come to you, and I would want you to add to this further. So typically we do understand that monkeypox is usually a self-limited disease with the symptoms lasting 2 to 4 weeks, the incubation period usually being 6 to 13 days. But as a doctor yourself, how would you describe its most common signs and symptoms to be for the benefit of the audience?
Yeah, so since monkeypox is a viral infection, most of the viruses, they give symptoms of flu and fever-like symptoms. So those are there in this monkeypox as well. And then there is generalized body weakness and pains in the back. And one typical symptom which is usually there in monkeypox and is taken as a sign of monkeypox, and which is like a confirmation, which is there are small pustules or pimple type of growths on the skin, which
on the entire body.
On the entire body, sometimes on the back, sometimes on the hands, but it can be on the entire body as well. So that's a diagnostic sign of monkeypox.
Monkeypox, right? And so they are also, of course, it can also be accompanied with fever, with low energy, with swollen lymph nodes, and generally rashes otherwise too. But when we do talk about its treatment, we also understand the fact that antiviral treatment is not prescribed in every case. It would then depend on the severity of each particular case. So when it comes to the treatment, what would the ideal treatment be for anybody who is suffering from monkeypox?
So as you yourself rightly mentioned, it is a viral and it usually goes off by itself. So generally there is no specific treatment needed, no antivirals are needed, and because antivirals, they have their own side effects, and they are not, we usually don't encourage taking antivirals unless the severity is so much. So we give antivirals in severe cases or in people who are already suffering from other comorbidities. Otherwise, for a general healthy person who acquires this disease, we would just go with symptomatic treatment like pain relief, fever relief, and also like encouraging healthy diet intake. So and
so
also
supportive care is something that we need to stress upon, and of course also focus on prevention and self-care by that yardstick too. So in the event that you do get infected, you don't end up infecting others too. On which, madam, I'll come to you, and I would want you to add to this, but more so from your own line of work. So when we do talk about the various healthcare challenges or health issues, of course, that the Pakistani society is then faced with, here of course we do need to give due consideration to women health per se too. In this regard, when it comes to tackling issues of women's reproductive health, or for that matter advocating for family planning, how particularly does your department, in the course of doing its job, actually also do away with not one, rather quite a few socio-cultural nuances that it may come across in this regard? Because a lot of times we understand that these issues are those which might not have that level of acceptability at large in the Pakistani society, more particularly in the rural and of course in the remote areas of the country.
I'm grateful, and especially grateful because you have highlighted so many pertinent topics today. And I think family planning would be a universal theme. No matter we talk about ailments of children, But as we all understand, women are the child bearers. I think their health matters the most in the family setup that we have in Pakistan. And one of the important reasons for focusing on women's health, because if they become victim of some kind of maltreatment or they don't have access to contraceptive or family planning services, most of the women around the world, they might die. So it is really important to save their lives, give them family planning services so that they can plan their families better, have children with proper breaks in between, which is important for not only the health of the babies but also for the mothers.
Right. But in addition to that, we also understand the fact that you've also been using mass media sensitization programs. For one, you're also running this very successful drama, in line with, of course, working with a private TV channel, which very actively advocates and deals with the issue of overpopulation too. So how do you feel can Pakistani dramas at large, how do you feel can Pakistani electronic media, or even for that matter, social media, actually advocate for issues like, the importance of family planning?
Thank you. I think infotainment and awareness through infotainment is not the latest phenomena. It dates back. And I think in Pakistan's history, there have been numerous plays and dramas where social issues have been highlighted. Family planning is a kind of theme which is not really discussed much in the household level. So we really need to hammer certain messages and craft messages around family planning subject. But we have to put it across to the audiences comprising of youngsters, males, females, heads of families, mother-in-law, and such variety of characters which are present in one family. So I think infotainment comes in a way that makes our task easier. So lots of messages are embedded, and through infotainment we are able to put it across to lots of audiences all across not only the Pakistan, I must say all across the world.
Of course.
Yes.
And here, do you not feel then perhaps maybe adding the efficacy of getting vaccinated, getting your child vaccinated, that is something very extremely important, because it's a very intelligent way to get to the masses that way. Sir, I would want you to comment on this further. Now, we do understand that with regards to polio, and I'm quoting, the case of Karachi, we have seen that in the anti-polio campaign in Karachi, we've witnessed a 27% refusal in 40 of the 85 high-risk union committees, which were then covered on the very first day of the anti-polio drive. So when it comes to doing away with those attitudes, of course, of parents who might not be very, comfortable with getting their children vaccinated when it comes to polio, how particularly do you feel is the government working to do just that? What kind of innovative approaches are there so as to ensure that these drives, they are not only successful, but they are also sustainable long term?
Yeah, so it is a very pertinent question, especially in this environment when we have been vaccinating people for many things, and we have been reaching their doors for different vaccines at different times. So people are usually irritated that why you are coming again, and what's the interest of the government, why they want to vaccinate us. And also they usually ask that you are giving us vaccines, but where are other services, like we don't have clean water, we don't have health services. When we go in areas where such services are limited, so they arrange health camps, they arrange water filtration plants, sanitation services, so that these demands of the communities are met, because these are one of the reason for refusal. Then particularly from the point of view of polio, because we are going repeatedly year after year, and every year there are more than 5-6 campaigns. So there is a lethargy in the health workers, as well as from the side of the communities also. They don't respond. They say that you just came last month.
Right.
So this is,
they don't understand the importance of getting your child vaccinated periodically, which is of course the need of the hour. So when it comes to then of course giving in all these reminders, how effective is digital technology then? Because we have overall seen that there has been now a shift towards having clinics on wheels, of having mobile apps, of the entire component of telemedicine, that too post COVID-19. But how do you feel can such mechanisms then be incorporated so as to remind parents and communities about the repeated and sustained importance of getting their children vaccinated against polio?
Yeah, this is extremely important, and the government is also engaging new ways, innovative ways to reach the people, like they are using Instagram for messaging of health related messages. Similarly, Facebook, TikTok, others, and they are also trying to engage influencers as well. So the local influencers, they are usually aimed at, and they are encouraged to talk about these things and also to explain the mechanism basically. Because as you also rightly mentioned, the vaccines are, the single dose is sometimes not enough. So this mechanism has to be explained, that why we need to repeatedly give the vaccine.
But what about, by that virtue, involving the community at large? You must be remembering that in the COVID-19 vaccination period, initially there was a lot of resistance, but then we did away with it by very intelligently involving community leaders, by involving religious leaders. So why can we not involve them? And by that virtue, even, social media influencers who have a lot of influence on the Pakistani society at large.
Yes, definitely. So the government is, gradually moving towards this side, and we are using channels like Instagram, Facebook, and even TikTok, and also engaging local influencers. On beside religious leaders, we are also engaging with the young generation who are emerging influencers, and we are trying to educate them so that they can deliver our message.
This is something that we have seen happening in other parts of the world. For example, during the COVID-19 pandemic, we did see the Indonesian government very actively engaging with influencers so as to advocate for the importance of the COVID-19 vaccine per se too. And in this regard, madam, we also understand the fact that when it comes to your community outreach programs, you have also been very actively been engaging religious leaders and community leaders too. So on ground, how impactful has that been?
I think community comes in a big way in the sense that they have a lot of responsibility, and especially when we talk about the causes like family planning or polio vaccination, or you may name any other vaccination. Like during COVID-19, we have seen that for the behavior change, it is really important to make all those people participate,
Right.
and their voices must be heard by all others,
Right.
so that they can convince them and bring a positive change in their behavior. So social behavior change communication, which we normally utilize for not just family planning programs, but also for all other diseases. Look at AIDS, hepatitis, thalassemia, and I think there are about 10 diseases in which social behavior change communication plays a big role. If we know and we have the information at the right time, we can amend our behavior so that we can save ourselves.
Right.
So I think SPCC and communities, they go hand in hand.
Right. On which, Dr. Rana, I'll come to you and I would want you to add to this further, but more so from your own viewpoint of being an expert on infectious diseases. So when we do talk about monkeypox, and when it comes to then analyzing the level of vulnerability that it might have on different segments of the society, who would you categorize to be most vulnerable to it? Would it be older adults? Would it be younger people? Or would it be pregnant women? And also, sir, in this regard, what are the self-care and prevention tips that you would want to give to the people out there so as to possibly steer clear of this virus?
For any disease, immunocompromised people or young people or even old people are more susceptible as compared to the other population age groups, because their immune systems are weak. So any disease could affect them adversely, then it will affect to young population. But sometimes diseases do the opposite, and in 2009, I think swine flu pandemic, it was targeting mostly young people. So that happens also, but in majority of areas, it's the young and old population or immunocompromised. So what the precaution they should take is to avoid people who have visibly the rash or they are sick, and try to clean the surfaces which they touch. These are the similar examples, or precautions which we used to convey in the early part of the COVID-19 pandemic, when we were thinking that it is spreading exclusively through droplet infection. So all those precautions are still valid. Wash your hands frequently with soap and water. Use your own, if you go for the prayers, take your own jayanamas with you. So, and all other similar precautions which people are now used to through COVID-19.
In addition to that, to also very religiously perhaps wear a mask and steer clear of people who you possibly suspect have caught the virus too in this regard. But moving on, when we do talk about, the possible dangers of this very virus mutating, how imminent do you feel is that particular threat? Because over time we do see that, viruses in any form, they have that possibility of mutating to be something more dangerous, something more severe. So in the case of monkeypox, how imminent would you categorize that threat to be?
Monkeypox virus until very recently was not as infectious as COVID-19, and it was not as deadly as COVID-19. But in September, there was a major mutation in the monkeypox virus, which made it more lethal and more easy to transmit from one person to another. So there has been already a major shift, and that's why we are seeing such a major outbreak in African countries. That in first 8 months we have 14,000 cases with more than 500 deaths already. So it has already mutated to become more dangerous.
Right, so your point is noted. On which I'll come to you, Dr. Naeem, and I would want you to add to this further. So in your opinion, how imminent is the threat of this virus mutating, that too in a country like Pakistan? Because even when we do study other countries, we understand the fact that there have been countries where the virus has mutated into a very dangerous form, although that overall has been rare. But generally, the cases and the disease burden of this very disease and this virus, that in itself has been mild. So what should be the dangers for us as a Pakistani society when we talk about, evaluating that threat of the virus mutating?
Yeah, so the virus which has arrived in Pakistan, it is most likely the mutated one already. So, but even with that deadly version, it is not affecting everyone equally. So the people who are already immunocompromised or malnourished or have other diseases already or are elderly, so they are more at risk of going towards fatality and towards complications. But from the perspective of a general healthy adult, it is not as deadly as we saw in the time of COVID. And also the spread rate of this monkeypox is also very slow. It is not as you saw that when COVID was started, within weeks it was spread across the globe and the numbers shoot into millions. But for monkeypox, it has been going on for over a year in Africa, but still the numbers are in thousands. So,
and sir, is that because it is not an airborne disease, so to speak, airborne virus? Because it has to actually spread by virtue of contact, human to human contact, even human to animal contact. I was reading up about this, or for that matter with an infected or any kind of a service that you do come across which does carry the virus. So does this mean that we don't need to be that cautious about our international travel too? Because if it doesn't spread that easily, then perhaps international travel might not be impacted by it adversely.
Yeah, definitely. So, from the perspective of monkeypox, I don't think the travel bans will be there because the spread is not so rapid. So, it is the travel restrictions might be there, but bans will not be there. There will be advisories that you should not go to the countries where there are more cases. But then the good thing, as Dr. Rana also mentioned, is that the vaccine is also already available, and the manufacturer, they are saying that they can provide millions of doses within this year and also some additional doses in the next year. So this is also a good thing that we can immunize the vulnerable people who are more at risk of acquiring this disease. So the spread can be prevented more better and more effectively compared to COVID. And also, as you also mentioned, it is not airborne, so the spread is also slow.
Right, sir. Dr. Rana, coming towards you, I would want you to add to what Dr. Naeem just said. So when we do talk about, overall improving Pakistan's, surveillance when it comes to, of course, tackling with this virus, that too in a very timely manner, what measures do you feel should be necessary in this regard? We do have currently, measures being taken, stricter controls being exercised on the airports per se. But what more, in your opinion, needs to be done so as to control the spread?
It's very difficult to assess health systems capacity or preparedness for if a major pandemic comes. After COVID-19, a lot of resources have been put in strengthening not only Pakistan health system to better respond to any future pandemic, but globally also. But I think even at global level, we are far away from mounting a good response to epidemics yet. We have a long way to go. Yes, we are better than where we were in 2019 or 2020, but definitely we are not there where we should be.
Madam, I'll come to you, and here we must also talk about child rights and, of course, the health of the children, so to speak, as well. In this regard, a report reveals that globally nearly 2,000 children died daily due to air pollution related issues, making it the second largest risk factor for early death worldwide. So, to curtail this issue, what do you feel is the way forward? Do we need perhaps stricter enforcement regulations? Do we need to invest in clean and green technology? Or do you feel it goes back to the society? Our societal attitudes are something that we seriously need to revamp and refocus.
I think when we discuss infant mortality, we need to go slightly back. I think mostly mothers are conceiving the first baby when they are into their teens. So even at the time of birth, babies are underweight. So they are, prone to lots of diseases. And I think the climate and the negative effects of the climate change,
They are
also affecting. Yes.
Of course.
So we really need to be very careful. I think teenage pregnancies need to be avoided so that kids are born strong and they have immunity system. And I think mother feed, that can also play a big role.
Right.
And most importantly, mothers need to be given a lot of information and awareness because challenges lie within the families, but challenges also lie outside the families.
Right. But in addition to that, do you not feel when it comes to perhaps improving our air quality control, and this is something which China, more particularly Beijing, has done, perhaps having stringent air quality controls, that is also something that will happen, because you see, then again, this is an issue which becomes extremely rampant in the winter, in smog, especially in the winter season in Lahore, so to speak.
You are absolutely right, but when I look at the government measures, I think the current government headed by the Chief Minister Punjab, they have taken environment agenda very seriously.
That's right.
And they have made it a multi-sectoral kind of agenda, and lots of government agencies, they have been instructed to change their working so that we can easily cope with the climate change and all the negative effects coming.
On which, Dr. Naeem, I'll come to you, and here we must also, of course, give equal consideration to this growing issue of dengue as it does stand in the Pakistani society, more so in this rainy and monsoon season, so to speak. So when it comes to curbing the spread, what responsibility, in your opinion, then lies on the society and the community at large? Yes, we do understand that we do have strict SOPs in place. Yes, we do understand that, there is surveillance so as to, of course, overall look at the disease burden too. But overall, when we do talk about, the community being perhaps more responsible by doing little things like, covering water tanks, making sure that, they don't leave open and stagnant water so that it doesn't become a breeding ground for mosquitoes. How particularly do you feel can the community be better educated and sensitized to take all these steps to steer clear of dengue?
Yeah, very pertinently mentioned. As we generally think that the government is supposed to do all the services, all the preventive activities, the government is responsible, the state is responsible, and but from the perspective of dengue, I think it is the responsibility of each one of us. For example, the government is doing surveillance from door to door. They are going and checking for stagnant water. They are checking for dengue larvae. They are doing sprays, fumigation, and all those activities. But it is not possible for the state to be present everywhere at all the times. And we are responsible for keeping our environment safe. And so at least the individuals should look at stagnant water in their surroundings, in their own parkings, in their porches and like roofs of their households.
And also, in addition to that, we've generally seen other waterborne diseases like cholera, like typhoid. They have also been, of course, on a stark rise too, that too during this season, because a lot of times we see that perhaps people who are eating out or who are eating from street vendors, having different foods and different kinds of refreshments from them, they perhaps might not come across the most hygienic food. So in this regard, what tips would you give to the people out there, that how can they ensure that by making little changes in their respective lifestyles, they can actually keep healthy, that too during the monsoon season?
The better idea would be to train them, to educate them that they have to ensure that the person who is selling is following all the hygienic principles. And also the person who is the seller, he should also be trained that they have to use clean water, they have to use boiled water at least, and they should also be educated that what their minor errors or things which they ignore can lead to even death of some of the people who are utilizing their products. So this is something on which we need to work on, and we need to make them aware and in their own language and in their local easy to understand ways, not through our medical terms and other things.
Madam, coming towards you and moving towards the end of the show, my last question to you would be that overall, when we do talk about wrapping up today's show, what are the areas you feel that we need to work upon? Yes, we do understand the fact that the government has been diligently working with regards to overall improving the common Pakistanis' access to the healthcare system. We have seen the launch of, first aid ambulance. We have seen clinic on wheels being set up. We have seen in that regard, of course, telemedicine being, of course, advocated for to a maximum level. But when it comes to, of course, the community's responsibility, what are those things that we should be very, careful and mindful of?
Yes, I think when we look at government's intervention, there are two sides. One is the demand side, one is the supply side. And the supply side is improving day by day because government is taking lots of measures and steps where facilities are being provided. If I talk about the family planning, and just give you an example, we have uninterrupted supplies of contraceptives, doctors are there, surgeries are being performed. But look at the demand side, not many people out there who are seeking such services. So this is another challenge for the government. When we have ensured the supply side, now we need to ensure the demand side, and that can be done only through creation of awareness so that people are sensitized and they take benefit of all these services which have been created for them.
Not only awareness, madam, but also in addition to that, strict compliance with the SOPs. That is something which needs to be focused upon, because if you're not ensuring strict compliance with the SOPs, then of course you can't expect people to make way and of course follow through. But moving on, do you not feel here that when it comes to overall improving the health infrastructure, how particularly can that be done? This is something that we did witness in times of course, floods and then COVID-19 as well, and so many other issues that the Pakistani society has been faced with. When it comes to overall revamping Pakistan's healthcare system, how then can we strive towards having perhaps a more stronger and a more resilient health infrastructure?
I think if we look at the public sector, the first thing that comes to my mind is the availability of data. If you have information and you have data systems, only then you can plan better so that you can ensure an equitable future for all. So the maintenance of data sets, having the right set of information and collection from the field is very important, and I think that's the first step before designing any program. And it would follow monitoring and evaluation, and it would also help in future planning. So I think having the right data is important, but I think we have come a long way in all public sectors. Technology is playing its role. Lots of softwares, dashboards are created, so you can have
AI has been
access to
integrated in Pakistan healthcare system.
That's the best thing. That's the best thing that has taken place.
We have robots
in the
now
recent
performing
past.
surgeries too. Yes, so we have made these advancements, but we need to ensure that we carry through.
I think Pakistan has also come a long way, and most of the government departments, they also work on emergency preparedness plans, and we have actually learnt a lot during COVID-19 and frequent floods coming. So most of the government departments, they have plans ready, they have equipment ready. We have like medicines in the stock, and we have a paramedical staff, they are also ready. And most importantly, I must salute their missionary zeal, because whenever we have such emergencies, human beings are reaching out to help the other human beings.
At the cost of their own lives.
At the cost of their own lives. And I have seen it in COVID-19. Most of the health frontline workers, they were not taking care of their health, but they were all out
even
there to
during the
support
floods,
others.
madam. So their safety at the end of the day is something that we do need to ensure as well. And this is something that we've seen just recently. We had this catastrophic case of violence against a doctor, a woman doctor, that too in the neighboring countries. So safety of doctors too, whether they are doing their routine duties or whether they are looking out for people in calamities like these, that is also something that needs to be ensured, because this again is a very pertinent issue. On which, sir, I'll come to you, and leaving on from where Ms. Saman left, I think here we we must also of course talk about this growing concern of safety of medical healthcare professionals like yourself, like that of course of that female doctor that we did recently see being raped and of course murdered in a neighboring country too. So when it comes to issues like these, what do you feel are the solutions to the same? Do we need to make these solutions in terms of perhaps having more stricter policies and laws so as to better protect medical healthcare professionals, or do you feel that it goes back to perhaps our societal attitudes at the end of the day? What would your suggestions be in this regard?
Yeah, I think it is again a multi-pronged approach. We need to go back to the society as well in general, but then also about the safety of the workplace is an important thing which is usually ignored. And there are measures which probably can be taken, like hiring of or appointment of security guards round the clock, and also about limiting the access of attendants. So there should not be the because here we see that with one patient there can be 10 attendants, there can be 20 attendants, and there is no restriction on that. So this is something which is it will not just be providing a safe environment, but will also be providing more quality of time to the patients as well, so that they can rest and also improve their own recovery process as well. In this, I think a maximum of 2 attendants should be allowed for one patient, and especially during the late hours like evening and night shift, the policy should be more strictly implemented, and that the visitors should not be allowed beyond certain hours, and also only one attendant should be there at night. So these are some things which are, if implemented effectively, they could provide a safe environment both for the patients as well as for the healthcare providers.
Right. So it goes back to basically the culture and the policies that respective hospital or that administration takes. And of course, these are very real issues. We need to look at them with regards to, of course, addressing the safety of doctors like yourself too. On which, Dr. Saab, I'll come to you, and before we conclude today's show, so my last question to you would be that, wrapping up today's conversation, when it comes to learning from, past viral outbreaks like that of perhaps smallpox, what are the lessons you feel can be then applied so as to not only effectively manage but also to contain, possible viral outbreaks of monkeypox?
I'm advising Ministry of Health of Pakistan in different roles. I'm working very closely with them since 2006, and 2006 to up to COVID-19, every major outbreak or pandemic or epidemic, I provided whatever support I could do to the government of Pakistan in managing those outbreaks or pandemics. What I think is missing is that we gear up every time there is a major epidemic or outbreak, and we then, become relaxed once that outbreak is over. What I'm advocating for quite some time, that we need to focus on strengthening our disease surveillance system, not just disease surveillance system, but start thinking about health intelligence system, which goes beyond a disease surveillance system, which is just reporting of cases of deaths or how many people are sick. So we need to start thinking beyond disease-specific systems. We need to think it on a national security manner. If a country is devastated by a major epidemic, its national security is then at threat. So we need to think about those terms, which I hope government will, and not only Pakistan government, but at the global level, people will start thinking about a comprehensive strategy and not just outbreak to outbreak.
Right, sir, your point is noted. On which note, I would like to conclude today's show. Thank you so much, madam. Thank you so much, Dr. Saab, and thank you so much, sir, for your time today. Well, to conclude today's show, we generally spoke about not one, rather quite a few healthcare issues that the Pakistani society is currently faced with. In this regard, we also spoke about this imminent and looming threat of monkeypox as it does stand in Pakistan. We also shed light upon, other waterborne diseases and the prevalence of the same, be it that of dengue, be it that of typhoid, or for that matter, even the growing refusals of parents refusing to get their children vaccinated against polio. In this this regard, whereas of course we do appreciate the fact that we do see the Pakistani government and the Pakistani state working so as to improve an average Pakistani's access to the healthcare system, there is still perhaps that needs to be done on part of the Pakistani society and the Pakistani community at large, because they say it right when they do say that, you have to be the change that you wish to or that you aspire to see in the world. Thank you for watching The Society. Until next time, take care and Allah Hafiz.